Tanmoy Mitra, editor of ET Edge Insights, and today I am in conversation with Mr. Vishal Chavan. He is the Joint Secretary, Ministry of Health and Family Welfare, Government of India. Mr. Chavan, thank you for taking your time out and speaking to ET Edge Insights. Let me begin by asking you, affordable healthcare and quality healthcare is one of the major concerns not only in India but across the world. So what is the government doing to initiate this process and to ensure that every citizen gets affordable and quality healthcare, especially the underprivileged?
You have to understand, that best form of healthcare is at the primary healthcare level.
Right.
And what government has done is to strengthen the primary healthcare by bringing a flagship scheme called Ayushman Bharat Health and Wellness Centers.
Right.
So what has happened in the far-flung areas of the country, about 160,000 health and wellness centers have been created. How these health and wellness centers are different from the earlier system is that now these health and wellness centers have additional manpower who is a trained nurse or a Ayush doctor. So there is additional manpower is there. These health and wellness centers ensure 14 type of diagnostic tests at the facility in the village itself available. They also ensure 63 type of drugs available in the village itself. They also ensure that through e-Sanjeevani teleconsultation platform, by sitting in their villages, they can talk to a specialist doctor or a medical officer at the district level or in the medical college level.
Right.
And also these health and wellness centers talk about, a lot of preventive and the promotive healthcare.
Right.
So health is not only which takes place only in the hospitals or in the tertiary care hospitals or in big hospitals. Health also takes place whether we are able to do the health lifestyle modifications, whether we are able to maintain right kind of BMI, what are we eating, how lifestyle modifications we are changing, whether we are able to fit or whether we are able to do yoga or Zumba or any kind of physical exercise. Right. Or cycling, right. Etc. So these are path-breaking reforms which have taken place in the primary healthcare center.
Right.
And also for secondary and tertiary care, we have a Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, where about, a cover of 5 lakh is provided to the citizens. About 60 crore citizens are covered in this scheme, where
Right.
5 lakh of health cover is provided. So right from primary, secondary to the tertiary care level, efforts are made by the government to ensure that, healthcare is accessible, affordable, and is adaptable as per the need of the hour.
Right. Right.
And as a result, what has happened is that, 5-6 years back, when out-of-pocket expenditure of the citizens was 63% or 64%, now as per the latest national health account, it has come down to 47%. So there is a continuous decline as more and more government is taking care of the health. The more and more there is a decline in the out-of-pocket expenditure of the citizens. So that's a very good sign.
Right. So going forward, how do you assess the healthcare infrastructure of our country, and in future, what are the trends you see that will drive this sector?
Now, if we talk of the healthcare infrastructure, you'll be very happy to know that in the last 8-9 years, the number of medical colleges have become double in the country.
Right.
We used to have about 50,000 UG seats. Now they have crossed more than 1 lakh UG seats per year.
Right.
Similarly, we used to have 30,000 PG seats in the country. Now we have more than 65,000 PG seats in the country in the medical sector. So lot of infrastructure has come in terms of the medical education. So availability of the doctors have increased. This year in the budget announcement, we have about 157 new nursing colleges have to be made up.
Yes.
So lot more nurses are going to come up, which will going to serve the country, as well as there's a lot of potential that these nurses can work outside the country also. So in terms of manpower, lot of reforms have taken place. Now, when we talk of infrastructure, during the COVID time, it was felt that, there is a need for a critical care block, because what happens if a contagious disease or a disease which is infectious, and if lot of hospitals got converted into the COVID hospital, so normal other services got affected. So now under the Health Infrastructure Mission, PM Abhim scheme, every district of the country is going to have a critical care block. So during the COVID time, they will work as a COVID hospital or any other infectious disease hospital. But in normal time, they will work for the critical care requirement of the citizens, whether it is an emergency, trauma, accident, or it is a cardiac emergency or a stroke kind of a situation.
Right.
So a lot of initiatives have been taken to strengthen the healthcare infrastructure in the country.
Right. So that's wonderful. Like, you've talked about, basically boosting manpower in the healthcare sector as well as taking care of, the critical diseases which we never know it may happen. One last question, Mr. Chavan. How do you blend technology along with the manpower in order to boost the healthcare sector?
So now what we have is a ABDM, that is a Ayushman Bharat Digital Mission.
Right.
What it is going to have is every citizen of the country will have a unique Ayushman Bharat health account.
Right.
So we will be able to track each and every patient in the country, whether somebody was referred to a higher facility from a village facility, whether he has reached there or not.
Right.
Whether he was told to take certain medicine, whether he is taking those medicines or not.
Right.
So every citizen of the country will have a AIBA ID. Every health professional in the country will be registered in the health professional registry, and every health facility in the country will be registered in the health facility registry.
Right.
So that is a Ayushman Bharat digital ecosystem is getting created, and it will ensure the integration of the various portals. Today we have, if we have 50 government schemes, we have 50 health portals, and these portals do not talk to each other. Through ABDM ecosystem, these portals will be talking to each other, and then we'll come to know that people may have multiple diseases, and then it will help in better management. Or somebody from district hospital going to a private hospital, he need not carry his entire record, and through ABDM, through a consent-based architecture, his records can be shared with any hospital, and also for the time duration, not forever. So this kind of a digital ecosystem is created. Now artificial intelligence is also coming in a big way. So we are using artificial intelligence for TB detection, we are using artificial intelligence for fraud detection, we are using artificial intelligence for detection of cancer, etc. So in the technology field, in the digital health field, major initiatives have been taken in the few years.
Mr. Chavan, thank you for your valuable time and for those wonderful insights. I wish you all the best for all your future projects and ventures. Thank you very much.
Thank you very much.
So this is Tanmoy Mitra signing out. Keep a lookout for more episodes like this on ET Edge Insights. Thank you.